And I want you to think about something. Why do you do aesthetics? Why do your patients do aesthetics? I want you to keep that in mind as I move forward through this talk. Back of your mind, keep thinking, why do you do it? It's not an easy question to answer. And why do your patients do it? What's the number one barrier to entry for patients coming into your office or coming to see you? Or the number one concern we see, whether it's on social media? It's this: I want to look natural. Last year, AFPRS, Facial Plastic Society, took a survey. The number one concern patients had is, I don't want to look unnatural. They all say that. Everywhere I travel in the world, people are saying, I don't want to look unnatural. Why does this happen? Why is this so common? We see it everywhere. Do we get used to this? Do we think it's natural? Does a person who looks unnatural start to think they look natural? And the answer to that question is yes. We get a visual adaptation. The more you see something, the more you get used to it, you actually start to think it's attractive. If you spend more time on social media, you take all this in, you will change what you think is attractive. You will also think it looks natural. It's visual adaptation. It's called perception drift, coined by Sabrina Fabi and Kate Goldie in 2016. And we as providers get aesthetic biases also. We start to think it looks normal. So if you walk into a doctor's office or a provider's office or an esthetician's office and everyone looks bizarre or strange, run, because likely they think that's the norm. And then, do we teach unnatural? Is it partially our fault? Are we going out there and teaching unnatural? This are clinical trials. This is a patient in a clinical trial. 2-point improvement in the wrinkle score. Looking at her nasolabial fold right here. When I do clinical trials, I have a research group, we've got to prove a 2-point improvement. That means I have to make that look bigger. I have to, on a photo, you can't see that wrinkle. So we look at it on a scale, and she gets a positive score. Great, the product works, the filler works, her wrinkle is gone. But watch her in animation.
Mary had a little lamb.
And the second line?
Twinkle, twinkle, little star.
And then the third line?
Little Bo Peep has lost her sheep.
Do you guys see it?
For me?
Look a little bit closer,
Mary had a
okay?
little lamb.
Look right there,
And the
nasolabial
second
folds.
line?
Twinkle, twinkle, little star.
And then the third line?
Little Bo Peep has lost her sheep.
Okay, and then can you pucker for me? Okay, smile real big.
Do you see that smile, how unnatural it looks? That smile looks unnatural because there's so much filler in there. So while it looks perfect in a static photo, something you publish in a paper, say, look, we're successful, in real life, it looks unnatural. But that's how we teach, because our success is defined by wrinkle scores, by how deep the folds are, by perfect proportions. When I was coming through medical school and residency and fellowship, we were taught to make perfect faces. That's how you make people more beautiful. But that's not necessarily helping people to look more authentic, look more real, or actually giving them what they want. It's time that we power our initiatives with the established science of neuroaesthetics. And that's what I'm going to talk to you about more today, because we're in this new era, neuroaesthetics. Once I give you this talk today, you're going to leave here today, you're like, I cannot believe we've overlooked this for so long. The science is so well established. We know that we do so much more than influence just the way people look. It's not about structure and function. It's not just about treating faces. What we're actually doing is influencing perceptions, emotions, impressions. That's what we do. If we look past the face to the neurobiology of what we do, we look at the face completely different. You start to see it differently. The more you become an expert in this, the more you see the face differently. You know, artists, when they're experts, will look at a painting, and when they compare art experts versus people who are novices or just started art school, an art expert sees the picture differently. They see the relationships, they see the abstract meaning. They don't look at the surface. The same thing happens with us. When you start to learn the neuroaesthetics of the face, you start to see the face different and you treat it differently. But the first thing we have to do is we got to define beauty. If I ask you what is beautiful, you all will tell me something different. And as Alex had mentioned, I taught a class for 10 years at DePaul University, an undergraduate course. It was on the science of beauty. And every day in the first day of class, I would say to my students, how do you define beauty? And I'd get so many different answers. Oh, doc, it's all about the eye of the beholder. It's only skin deep. It's all about the eyes. No, doc, it's all about the butt. Everyone had a different answer to what beauty was about. But the reality is, if we look at it from a scientific purpose, beauty serves an evolutionary value. Beauty says, I am healthy, I am well, and I have good genes. It is an evolutionary preserved form of communication that's consistent through all species. Whether it's an animal, plant, or a human, I am healthy, I am well, I have good genes. It's survival of your genes because you only have one purpose on earth from a biological standpoint. I'm not talking religious, I'm not talking philosophical, I'm not talking psychological. You only have one purpose on earth, and that is to procreate and make a better offspring from a biological purpose. It's not everything else. So I don't want to be politically incorrect, but looking at it as a scientist, everything stems back to that. How do you get your genes to survive? So now, if I tell you that beauty serves an evolutionary purpose, and we're all the same as humans, do all cultures find the same thing beautiful? If I drop you off in Papua New Guinea, do you know who the most beautiful person in that culture is? And the study's been done. And the answer is, at first you don't, you acclimate, and then you could pick out the person in that population that's the most beautiful. 50% universally, we all share what we find beautiful. 50% of it is all the same. You see it, I see it, it's reflexive. You don't think about it, it's subconscious. You see someone, they have good genes, it imparts on you, you feel it. 50% of it is common. Now, there's some differences, of course. If I go to the Mercy tribe in Ethiopia, they put a 14-centimeter lip plate and they have these huge lips. They find that attractive. In Asia, less expression on the face, smaller chin, smaller mouth is considered more attractive. In South America, bigger butts, bigger boobs are considered more attractive. So there's some nuances that are different culturally, and you have to be sensitive to those. But 50% of what we all find attractive is the same. So let's talk about that part. That's beauty, that's subconscious, and that's rewarded. You get a dopamine surge. When you see something beautiful, you feel good. You get euphoric. In a study done by Joel Winston in 2007, which completely changed the way I think, he asked people, do you think these people are beautiful? They weren't rewarded anymore. But when they looked at the photos of these people and they did functional MRIs to map their brain blood flow, when they saw somebody that was beautiful, they got rewarded. So without thinking about it, they were rewarded. The same study has been repeated now with wine tasting. If I have to ask you, is the wine good? You're no longer rewarded. With paintings, if I say, is the painting pretty? You're not rewarded. But the minute you see something beautiful, you feel good. You feel euphoric. Bottom line is, if you have to think about beauty, you're not rewarded with the pleasure of beauty. So beauty is subconsciously imparted. You value it subconsciously. Now, how do you do that? As an aesthetic provider, regardless of what you're doing, whether you're doing nails, hair, surgery, fillers and toxins, how do you get someone to subconsciously feel more beautiful? I'm going to teach you. I'm going to give you hacks. And if I give it to you today, I promise you, I'll teach you some things today that you can use in your practice and your business tomorrow. Even if you're in industry, I'm going to give you some tips today that you can use. In fact, I'll tell you what, I'll make you a promise. If I don't give you at least one tip that you can use Monday morning in your practice or in your job or in your industry, I'll buy you a bottle of wine. But if I give you 3 tips, you got to buy me one. How about that? Okay, I'm going to give you a bunch. Here's one. In 1/100th of a second, you make a first impression. And you judge other people. You don't even realize you do it. You judge other people. Where's the first place you look on our face? Most of you get it right, the eyes. Why? Because we like eyes. They're non-threatening, they're infantile. We like pretty eyes. This is what we find attractive. This is what we find attractive. It's non-threatening. It's favorable. Second place you look is the nose, because you're judging symmetry. The more symmetric someone is, the healthier they are. But the first place you look is someone's eyes. 1/100th of a second. Females, women, when they're attracted to something, their pupils dilate up to 8%. Blue eyes are more attractive than brown eyes. In our clinical trials that we do on first impressions and attractiveness, blue eyes are more attractive. Anyone want to guess why? Because you can see the pupils dilate. When someone's pupils dilate, they're interested, they're attracted. Does a man and a woman, they're in a bar, or 2 people are in a bar and they're interested in each other, the pupils are dilating, does he or the partner, the person that's in the romantic interest, pick up on that? Not consciously, but subconsciously they do. Then they move in closer to each other. All of this communication is a dance that happens between 2 people subconsciously that's occurring. We're influencing that with what we do. Wide eyes are attractive. Narrow eyes are a threat, whether it's an animal, a guppy, puppy, or a human. So can we use our products, botulinum toxin in particular, to make the eyes wider and more open? First impression. Who makes a better first impression? You get 100th of a second. I do these studies in my office. What's the difference here? Her eyes are more open. It's just using neurotoxin. It's not about the wrinkle. We're focusing on the wrinkle. No, it's about making the eyes less threatening, more infantile. Make the eyes pop with neuromodulators. We don't teach you how to do that. I teach you how to remove a wrinkle. I teach you how to get rid of forehead lines. I teach you how to get rid of crow's feet. But I don't teach you how to make the eyes bigger because that's not on label. And the companies aren't allowed to teach that. But that's where you really make someone look better. So hack number 1, micro expressions equal macro impressions. Subtle, slightly changed, less than 1 millimeter in the face, completely alter your impression of somebody. This is a study by Walker and Vetter in 2009. It also changed the way I practice medicine. Can you see those differences? Unknowing observers looked at these different faces and rated them differently, judged them differently. You can't see it. Your eyes see color, but your brain sees contrast. If I put the picture in contrast, it becomes a little bit easier to see. But you can't see that. It's really hard to see it on the screen because it's a PowerPoint, but in the PDF you can see it a little bit better. So I started doing that in my studies. So who makes a better first impression, her or her? Her or her? Can you see that difference? You have 100th of a second. Who makes a better first impression? You only get 100th of a second. Do you see the difference? Widening the eyes, opening the eyes. I did some other work around the corner of the mouth. She makes a better first impression afterwards. If I put the picture in contrast, there's changes in the muscle patterns. Now you see that. Changes in the eyebrow position, a friendlier, more inviting orientation to the eyebrows. These are now things you see that you didn't pick up before. Do you see it now? Once I teach you this, you're like, oh my gosh, it's there. And you start to see the face differently. You start to treat the face differently because now you're working with micro expressions. Who do you trust more? Obviously, it's not the greatest picture of Jennifer Aniston, but it was lined up perfectly with Nicole Kidman. And it so well illustrates my next point. All of you think the same thing. We all do. How is it that we all think the same exact thing? What is Nicole Kidman missing that Jennifer Aniston has in this photo? She's got crow's feet. Should I remove all the crow's feet? In our clinical trials, we remove all the crow's feet. But that's not what makes a patient look better. So a study done by Nancy Etkoff, who's an evolutionary psychologist at Harvard. I love this study. She showed that these patients who have all of their crow's feet completely gone maybe look attractive, maybe even look a year younger, but they don't look genuine. So yes, they look better, but they look less genuine and less happy. Less genuine and less happy. The reason why it's called a Duchenne smile, when someone smiles, you can tell if they have a fake smile. If they just smile like this, but this doesn't move, you don't trust them. You back off. You back off. A Duchenne smile is critically important. The nasolabial fold, the zygomaticus muscle, and the orbicular oculi muscle have to work in concert. You pick up on it in a split second, 100th of a second if that's off. Yet we take away crow's feet because we think we're doing a favor to the patient by removing their wrinkles. We're actually making them worse. We remove their genuineness. In clinical trials, we call it genuineness or authenticity. Trustworthiness is another word that we use in our clinical trials. What we call it colloquial is naturalness. The patient doesn't look natural. But I can't make someone more natural. You're born natural. So aesthetic medicine doesn't make people more natural, but what it does do is I can preserve genuineness. I need to preserve genuineness, not remove it. The only thing you do when you treat someone is you take away their authenticity. You take away their genuineness. So you've got to protect that because people who are genuine succeed more in life. A game called Prisoner's Dilemma, for those of you who are psychology students, you might remember this. We talked about it a lot in Psych 101. Prisoner's Dilemma is a game to see how you interact with someone else. If the person's genuine, you will spend more money to interact with someone who's genuine versus someone who's more attractive. We like genuine people. We associate with genuine people. We pick up on that. We need to trust them, and we're willing to pay money to work with them. So I did a clinical trial just recently. This paper just got accepted. My clinical trials now, I do observer-reported outcomes. It's not just a 2D picture anymore because you can't see all the changes. In this photo, in this video image, you see the same person here, but the observers, the raters, never see the same person twice, and they have to rate her on attractiveness, approachability, healthiness, and the person on the bottom rates much higher. because all of her animation's intact. Yes, she's got filler in her lips. Yes, she's got botulinum toxin in her crow's feet and her forehead and in her glabellar area. Yes, she's got filler in her cheeks, but she looks better. I didn't remove her genuineness, and she rates statistically significantly better in all these categories. She looks happier, too. Doesn't she look happier in the bottom picture? But is she actually happier? I mean, when you treat your patients, you make them look better, but do you make them happier? Are they happier people? And can you prove that? So I got interested in this because my patients come back and they say, Dr. Dayan, I think my life is better since you've given me these products. I'm like, oh, great, I love it. And I used to hear it all the time, but then I'm like, is there something more to it? So I did a study on it. You make a first impression. Who's happier? You get a hundredth of a second. All you see is a third of her face, and you all think the same thing I do. A third, you don't see her eyes, the most revealing part of someone's face, the part of the face that gives the most information. You don't see, all you see is the corner of her mouth. And yes, she looks happier. She looks happier. Is she happier? Did I force a mechanical smile? Did I lift up her corner of her mouth to force a mechanical smile? So yes, we proved it. In this clinical trial, I've proven both with neuromodulators and with fillers, I can force a mechanical smile with fillers and make someone interestingly happier. And I can also reduce glabellar frowning and make people feel better self-esteem and quality of life. So wow. Facial feedback hypothesis. If you smile, you become happy. If you frown, you become angry. First described by William James, 1862, and Charles Darwin. Expressions precede emotions. You don't get sad and then frown. You don't get happy then smile. It's the opposite. You smile and you become happy. Next time you're unhappy, try it. It's bizarre. It works. It works. You're unhappy. Just smile and look up to the sky. You will become happier. It's crazy. I've tried it before. I've had other people try it. It's called the facial feedback hypothesis. It's well established. How does it work? It affects the blood flow from the cavernous sinus, from the brain. It affects the amount of blood that drains from your face, which affects the temperature of the brain. This is proven in vascular physiology of animals. In humans, it's not so well proven, but that's where we get the data from it. Facial feedback hypothesis. Now, let's take this lady, apple cheeks. We all see that, we're like, oh, it doesn't look so good if she has apple cheeks. Can that affect mood? Well, yes, because there's a ligament called the transverse septum, which sits underneath the zygomaticus muscle and encases the deep and medial fat pads. If you put too much filler in those deep and medial fat pads, when you smile like a belt, it pulls really tight. It's like pulling your waist falls over. You see that apple cheek pop out. So we know why it happens. It doesn't look good. It's too much filler deep in that pocket. Zygomaticus muscle pushes against it. That was shown by Sebastian Codofona most recently. But this is where I connected the two. Because Zajonc showed that if you reduce the blood flow from the cavernous sinus, from the brain, people get aversive. They get sad. They get sad. So yes, when we feel good, we look good. When you feel good, you look good. When you look good, you feel good. It's reciprocal. It's not just poetry. It's not. So we're neuroaesthetic hack number 2. Expressions influence emotions. So the first tip I gave you is micro-expressions. Preserve those micro-expressions. They're critically important to genuineness and attractiveness. Number 2 is you're affecting moods with the products you put in someone's face. Now, here's the third one. Can this be contagious? Is this contagious? If you're happy, does the person you're talking to become happy? And the answer to that question is yes. Why? Because we empathize with each other. When you look at someone and they look at you, you start to smile if they smile. If they're sad, you get sad. You don't even realize you're doing this, but we all do it. It's how humans empathize with each other. Today, when you leave here, go outside and watch two people talking to each other. You're going to see them looking at each other, and you're going to see one person start to smile, the next person smiles. We mimic each other. It's mirror neurons. We all have them. They're embodied. And they work in absence of cognition. You don't even realize this is happening. And then this becomes contagious. Fowler showed this in the Framingham study, up to 3 degrees. So if you're happy, your neighbor becomes happy. Your neighbor then talks to their wife, and she becomes happy, then talks to the next door neighbor. All of a sudden, your happiness spreads. Neuroaesthetic hack number 3, Mood is contagious. Micro expressions are macro impressions. Expressions affect mood. Mood is contagious. Now this is where it starts to get bizarre. When we're with other people and we're just in their presence, do we feel their energy? People talk about their energy. She's got great energy. He's got great energy. I love being around their energy. Does that exist? Is that real? And do we influence that? I'm a vanity doctor, right? I make people more beautiful. Do I affect their energy? So this started getting to me because of this. COVID is when I really, so everything I gave you up to now was written in my 2014 book. It was a New York Times bestseller called Subliminally Exposed. But now this is where I am. This is what's really blowing my mind, and this is where my research and my thinking is now, and it all happened around COVID. Physical isolation, we were depressed, we were lonely. 50% of people now today are depressed and lonely. The Surgeon General in the US just made it an epidemic, a public health emergency. We are in a crisis of loneliness. We are socially connected but neurobiologically disconnected. We are screen exhausted, and it's mostly affecting children. Mostly affecting children. Substance abuse skyrocketed during COVID. 23% increase in illicit substance abuse and alcohol. So we thrive when we're in presence of other people. We're humans, we are social beings, we need other people. As much as we think we like isolation, we don't do well with isolation, and this makes it a lot worse. Behind the screen, and I'm sure many of you know that you're virtually behind a screen, something's missing, and I recognized this during COVID. Something was missing. I didn't feel like I was connecting with people. Kids, I'm not sure how many of you have kids, okay? 57% of teenage girls lonely, depressed, or sad. 32% considering suicide. 13% attempted suicide. Really? What a problem. Why do 57% of our kids are feeling sad, lonely, and depressed? It's too much of the screen time. Over 3 hours. Once you get to 3 hours is when all the detriment happens. 2 times increased mental health disorders over 3 hours. You got to pull it away after 3 hours. That's where it seems to be the cutoff point. How about boys? Well, guess what? They're also being damaged by this. 30% of boys don't have any good friends. 45% of Gen Zs have never asked a girl or approached a girl on a date. 63% of young men under 30 are single. 25% are living at home. What the heck is going on? The screen is really an issue, and we're starting to realize it more and more now. So my aha moment came during COVID. Is it that we're just behind the screen, or is there something that we get when we're in the presence of others? And does our skin play a part in that? Here's my fourth neuroaesthetic hack. Skin is not a canvas. It's a sensory signaling organ. You perceive others, they perceive you, all subconsciously. And this is where I'm hopefully going to blow your mind. So pay attention over the next 15, 20 minutes. Primary germ layer. Do you realize your skin and your brain evolved at the same time? They're both from the ectoderm, the 3 germinal layers in embryology. For those of you who remember embryology, skin and brain developed at the same time. Your skin is packed with neurons and neuropeptides and neurohormones. We know the skin and brain communicate with each other because when you're nervous, when you meet someone, you flush. Substance P is released, VIP, acetylcholine. All these hormones get released. What is the purpose of flushing? You're signaling to someone else, yeah, I'm a little nervous. Guess what? If they flush, you become more attracted to each other. Isn't that interesting? 2 people flush, become more in synchronous. Their heart rate goes more in synchronous. Their skin conductance is more in synchronous. They actually become more attracted to each other. Flushing is a way of communicating to someone else. We're nervous. You signal to others. You're nervous. Your skin is a certificate of health. In this clinical trial, which I thought was very interesting, people were under fMRI. They looked at faces. They didn't know if there were any changes. Some skin was matte, some was oily, some was radiant. Radiant skin was a lot more attractive. The people with radiant skin were considered more attractive and younger and healthier. More attractive, younger, and healthier. Radiant skin. Matte and oily, not so much. Your skin is a certificate of health. It disproportionately influences the impression someone gives off. Disproportionately influences the impression someone gives off. Skin comes first. I'm a plastic surgeon. I want structure and shape to be more important. Sorry, plastic surgeons, you got to take a seat back. It's about the skin. The skin comes first. Structure and shape is important. So, your 5th neuroaesthetic hack, optimize the skin because it makes people look healthier. So, first impression studies, once again, we do them. Who's healthier? This one's pretty easy, right? Do you see that difference? Who's healthier? Who's more attractive? Who's younger? Skin comes first. So take that and you disproportionately increase the first impression someone makes. Now, your skin's got 5 million free nerve endings. Does it send signals from the environment? So we know that if you carry a hot cup of coffee, you actually become, the people around you, you think are nicer. If someone gives you a warm cup of coffee, the person who gives you the coffee, you think more favorably of them. Versus a cold cup of coffee, you think less favorably of them. Isn't that interesting? A study done by Wow and Barr at Yale University in 2008. I found this study fascinating. It shows that what you hold in your hand influences what you think of the person that gave it to you. On top of that, you become more generous. If you carry a warm cup of coffee, you're more generous than if you carry a cold cup of coffee. What that tells me is in my office, I'm not serving any cold coffee. I'm just serving warm coffee. Warm coffee. So your skin senses that. You have alpha and delta receptors in your skin, the neural endings, and they pick up on temperature, and it influences the way you think. So it's like, okay, I kind of knew some of that beforehand, so I'm thinking about that. Our skin senses that. But then this paper blew me away. When you feel something, when you're in a dark alley, something eerie is happening. But if you don't hear anything, you may not even smell anything, you may not see anything, but you sense eeriness. Now, here's the interesting thing. Women are much better at this than men. Men were not so good at this, but women, you're great at this. So you sense something's going on. Your piloerector glands, your hair stands up, your skin conductance, you start to sweat a little bit, your neurons become sensitized, your eyes open wider to let more light in, your mouth opens more to let more oxygen in. All this happens at a subconscious level. But does this happen in blind people? If a blind person walks down a dark alley, can they recognize danger? So the answer to that question is yes. And I got blown away by this. So I read this article, I heard a podcast on it from this physician, then I read the article. I'm like, how do blind people detect danger around the corner? A barking dog's around the corner, or a dangerous animal, and they can sense it. How do they do that? Well, now there's multiple clinical trials that have shown, without a doubt, there's some embodied sense that we have that allows a blind person to detect danger. So subconsciously, you effectively pick up on this. So I thought this was interesting because I wrote a book on the science of beauty, and fear and beauty are both processed in the amygdala for survival. It's a primitive part of your brain. They're both processed there. Can blind people detect beauty? So we tested it, and this is what the study looked like. Person comes into the room, sits down, and that person can see, so she's got a rate. 30 seconds later, my proctor comes back and then says, what do you rate this person on a beauty scale of 1 to 10? Then that person comes back in, another person comes in blindfolded. What do you rate her? This person can see. Then we did the same thing with the blind person. Blind person, and we had people from the University of Illinois, the retinal clinic, who have 2400 vision or worse. They have to rate people. And what do you think we found?
5.
I'll show you the blind person next. This was the blind person. She's got to rate someone. And then we blindfolded her also. The blind people found the same beauty as people who are normal seeing. How is that possible? How is that possible if blind people can detect beauty? But they do. The women who came in, you saw no makeup, no hair care, no shoes, no jewelry, so they couldn't detect anything else. Blind people were able to detect beauty. I published that paper in 2019. I thought that was pretty groundbreaking. Your skin-brain connection is a sixth sense. You sense others in your vicinity, and it influences the way you think about yourself. We communicate in this subconscious pathway. Now, if I told you 30 years ago, 20 years ago, you're going to be in a room and you're going to be talking to someone in Istanbul and you're in Trenton, New Jersey, on your computer, in real time, and there's no cords connected to your computer. You'd be like, how? I'm like, well, there's something called Wi-Fi. It's all in the air here. You'd be like, wait, what? Yeah, Wi-Fi. Through Wi-Fi, you can talk to someone. You don't need any cords. You're going to be like, no way, I don't get it. That's not possible. I'm telling you the same thing here, because I'm telling you about it now. Mark my words, 5 to 10 years, 15 years, I'm going to be retired. You guys are going to be talking about this pathway in which we communicate with each other subconsciously. Why? Because guess what's coming? AI and robots. AI can outcompute us, outthink us. But what AI and robots can't do is outfeel us. I believe the sense is going to become increasingly more important, and we're going to rely on it to know what's real around us. Would you be surprised if I told you your skin has serotonin, dopamine, melatonin, and oxytocin in it? These neuropeptides are all in your skin. Oxytocin is where I have particular interest. As someone who's studies the science of beauty, oxytocin is so powerful because it's synthesized in the skin, it's anti-inflammatory, and it also increases in the brain. If you increase in your skin, increase in your brain. So your skin is full of oxytocin. Oxytocin, to many people's respect, is nature's medicine. When you're in menopause, estrogen is the protagonist. Estrogen is the star of the show. She drops 90% within the first 2 to 5 years. But guess what else drops? Her cousin, oxytocin, the supporting actress. The supporting star, oxytocin, also drops. Skin looks worse. You lose 30% of your collagen in the first 5 years, 2% thereafterwards. 50% of your hyaluronic acid is gone by the age of 60. Skin looks dry, erythematous, breaks down more easily, less sebum production. Oxytocin drops and estrogen. Nicole Hare published this paper in 2019 that when oxytocin levels go higher, your skin looks more youthful, despite how much sun damage you have. So increased oxytocin levels, better looking skin. That's impressive. But where I'm fascinated by oxytocin, where I'm fascinated by this, is this the love hormone. You know it. You know it because you've been in love. If you've ever been in love, you glow. You know when you're in the office, someone comes in, they walk in, and you're like, wow, Joan, you look good. You must have had a good night last night. Guess what? She had a good night, and you're picking up on it. You see it in their skin. It's an oxytocin flush. For women who have breastfed, they will tell you it's some of the most serene, most enjoyable, most euphoric moments of their life is breastfeeding. Oxytocin never goes higher than when you breastfeed. And when you're in love, you become drunk with oxytocin. Your relationship gets better. Men stand closer to you. You trust your partner more. Your pupils dilate. And then guess what? Your brain releases more. It's a positive feedback loop. So of all those neuropeptides I showed you in the skin, oxytocin is the most incredible one in my opinion because there's a positive biofeedback with the brain, releases more from the brain. And nobody looks better than this. This is Sabrina Fabi, Dr. Sabrina Fabi, who's my partner in life and business and in parenthood now. We sheltered in place during COVID. So all of this that I'm talking to you about was her and I teasing this out together. But when this happened, wherever the screen is, when this happened, she got pregnant, I was like, oh my gosh, you glow. She lit the room up. She lit the room up. Her skin looked incredible. Can we bottle that? Can we find a way to increase oxytocin levels in the skin? Because oxytocin is love hormone, not only makes your skin look great, but I knew, as an expert in the science of attraction, it plays a pivotal role. Parturition, lactation, memory. It's an antidepressant, an anxiolytic, an analgesic, sexual performance, sexual arousal, social interactions, fosters pair bonding, trust and attractiveness. All these things increase with oxytocin. Well established, well known. But the problem is that oxytocin is too big of a molecule to get through the skin. So let's go back to your skin. It surveys your environment. It signals your health and beauty to other people in the room. And it senses the intent of other people. All this is happening with your skin alone. You feel attraction before beauty is seen. Your skin works the room before you do. It's so much more than a wrinkle or a fold to be corrected. How do we spend so much time talking about wrinkles and folds? Collagen and elastin and cytokines. No, excuse me. We have the most powerful organ for communicating with each other, and it's our largest organ. It's our emotional organ, and we're focusing on collagen and elastin. Come on, guys. Let's skip over collagen and elastin. We're done with that. Yes, I can increase collagen and elastin. I can rub your arm with a brush for 5 minutes, increase your collagen and elastin. I don't want to see collagen and elastin. Tell me what your product is doing to make my life better, to make my patients' lives better. So Sabrina and I, we, of course, our pillow talk, not only do we make a baby, but we also talked about oxytocin and skin. She's a dermatologist, and she's an expert in the skin. I'm an expert in the science of attraction. So together we're thinking, let's investigate this. Can we increase oxytocin levels in the skin? No, you can't. You can't get it through the skin. It's too big of a molecule. But then we found something about jasmine. Many of you who know jasmine, women wear it in their hair during ceremonies, birthing ceremonies. It's part of potions, lotions, perfumes, aromas. It's got a great smell. It's in baths in Japan. If you want to go to a foot bath, it's an anxiolytic, it's an analgesic, it's an antidepressant, maybe even an aphrodisiac. So jasmine has this storied history. Well, there's a reason why. There's a derivative of jasmine that can increase oxytocin levels in the skin. When I found that, I'm like, oh my gosh, how does that work? Well, 2021 Nobel Prize, piezo-1 receptors sit in your skin. Jasmine grandiflorium can stimulate those piezo-1 receptors to increase oxytocin levels, because oxytocin is made in your keratinocytes and in your fibroblasts, and you have receptors there. So I can increase your oxytocin levels in your skin through this mechanism. Now, I can also increase your oxytocin levels in the skin if you hug someone, or if you get a massage, or if you pet a dog. There's many ways to increase your oxytocin levels in the skin. And then with the positive biofeedback loop, it goes up in your brain. But we got to test it, because I'm not going to get up on stage. I'm not going to risk 25 years of reputation unless I test something first. So let's do a double-blind placebo randomized controlled trial. I'm going to say that again. Let's do a double-blind placebo randomized controlled trial. Let me say that again. Let's do a double-blind placebo randomized controlled trial. Why do I say that 3 times? Because nobody does that anymore. If you want to know if something works, you got to be honest. Placebo versus control. No one knows what the investigator doesn't know, the subject doesn't know. That's how we do drug trials. But we don't do it in cosmetics because we don't have to. No one has to. It's expensive, it's risky, but I'm not going to talk about something unless I do the trial first. So 40 female subjects, after 4 weeks, the placebo group crosses over to the active group, looking at skin quality and something completely different that no one's done before. Psychosocial metrics. Yes, I can make your skin look better. I can put peptides in there. Yes, I can do all these wonderful things, but I'm more interested in the science of beauty. What are our results? 39 people completed the study. 1 person dropped out because she got pregnant. I was like, wow, you got pregnant? Doesn't happen too often. 3 other people said they looked pregnant, and they were being asked, and 1 other person got pregnant afterwards. So I'm not saying that people get pregnant from it. They absolutely don't, but something happens maybe when people feel good about their skin, right? So let's look at skin quality. 7 out of 8 patients had statistically significant improvement in all these skin metrics. Wonderful. What was placebo? 0. Wow, that's a big difference. 7 out of 8 categories: improve radiance, improve, reduce dryness, reduce redness. So everything improved except wrinkles, but you wouldn't expect wrinkles to improve at 8 weeks in a double-blinded controlled trial. It shouldn't. If it's improving, then something doesn't make sense. Wrinkles don't improve that quickly. But radiant skin being the #1 indicator of health, fertility, attractiveness, and reduced age, was through the roof, statistically significant. So these were some of the patients in the clinical trial. You can see that. How about first impressions? I study first impressions. I've written over 24 trials on first impressions. Do these people make a better first impression? Yes, you increase oxytocin levels in the skin, you make a better first impression. You have better, people think you're more social, they think you're more attractive, and they think you're 3 years younger. How about more confidence? Using FaceQ, a validated scale. People felt more confident in a room where they didn't know anyone. All of this from oxytocin, is that possible? Confidence went from 60 to 86%. These numbers were staggering. Do they find the opposite sex more attractive? Oxytocin is supposed to increase your attractiveness to the opposite sex, especially if they're masculine looking. What is masculine looking? Square face, heavy brow, strong jawline. We tested that too. 7 out of 8 men became more attractive to them after 8 weeks of using a topical product. That's pretty impressive too. But the one that blew me away, the one that really blew me away, and the one that I wanted to test, Sabrina was against it. She's like, I don't think we should do it. I'm like, come on, let's test this one thing. I really want to test this one thing that no one's ever done before in an aesthetic trial that I've heard of. But I think it makes a big difference. Let's look at sexual satisfaction. What? Yes. Do I influence sexual satisfaction? Do you influence sexual satisfaction? I'm sure you're realizing this as much as I am. Sexual health and wellness, holistic health, and aesthetics is all coming together. Patients want it. It's all the same thing. They want to feel good about themselves. They want to be empowered. They want to feel well. Sexual health and wellness is part of that. That field is no longer taboo. Are we part of the discussion? Are we part of the conversation? I want to know. No one's ever tested that before in aesthetics. So we looked at it. We used a new sexual satisfaction scale, a validated scale, taken from their literature, and we asked these questions. Guess what? 90% increased sexual satisfaction in the categories tested. 90% of the categories tested increased sexual satisfaction. What was placebo? 0. I'm like, no way. That can't be right. It's not possible. So I called the statistician. I'm like, is this possible? And she said, Dr. Dayan, I rechecked it. The numbers are true. I was like, wow. Now, I don't know exactly why their sexual satisfaction got so much better. They felt good about themselves. Or was I influencing oxytocin? Or I put in isobutyric acid, which is also a aphrodisiac. It's a pheromone, if those of you know what pheromones are. So also interesting, the partners were also asked blindly, and in the patients, the subjects who got the product, the topical, they also had increased sexual satisfaction. That blew me away, statistically significant. So I was like, to the guys, I'm like, on Valentine's Day, forget the flowers, get her this. So this was all done for academic purposes. We were super interested. We wanted to see if it was possible, so we published it. Peer review, we put it out in a paper, and we put it out there in the community, and people are now seeing it. And I've written many articles on it, so if you want some of these articles, if you want to read it, please ask me afterwards. I'll be happy to give it to you, and I have some copies of these here with me. I have limited copies, but I'll give you these articles if you want to learn more about the science of this. But I will tell you, I may be the first part of this, but I'm not the end, because it's coming fast. Neuroaesthetics is rising. Mark my words, you're hearing it here, and you may not have heard of neuroaesthetics, but it's coming because I'm an editor of multiple medical journals. I am at many meetings that I'm the director of, and everyone's talking about this concept. Skin microbiome now and psychological well-being, study that came out in British Journal of Dermatology, one of the most prestigious journals. Increased cutibacterium on the skin, reduced stress, increased mood pleasantness. So we're starting to correlate the skin as so much more than just a canvas. So what's the neuroaesthetic framework that you do? You cosmetically alter someone's appearance. Secondly, that person gets their expressions influence their emotions. They feel better. If you do it correctly, you make them happier. They experience themselves. Then someone looks at them, picks up on that, makes a first impression, and evaluates them. Their mood gets better because they have mirror neurons going back and forth. Then that person looks back at them, has micro-affirmation, micro-avoidances. If they look good, they smile back. Then you get positive reinforcement of your good attitude. That confidence grows, and then it spreads beyond the dyad, beyond the two of you, to the community. Wow, all of that we do, we're affecting expressions, emotions, impressions, happiness, confidence, social relationships, maybe even society. We're aesthetic providers. It's not just plastic surgery, it's not just fillers and toxins, it's not just skincare, not just lasers. These are things that we do. We are so much more important, such a bigger part of the equation of health and wellness than just making a wrinkle or fold go away. We have to look at these people differently. It's so much more than making them beautiful or making them feel beautiful. We can treat patients from all different categories of life, even if they're cancer survivors or people in nursing homes. We can use aesthetics. If we can figure out how to dose it, we can use aesthetics as a tool. So it's time for aesthetics to evolve. Leverage the neuroaesthetic pathways, the established neuroscience that exists, making sure we get great results, natural results that work for you. And when we started, I said to you, why do you do aesthetic medicine? Why do your patients do aesthetic medicine? I'm not sure if you thought of the answer, but in my opinion, if I don't make your life better, and if your life does not get better, why are you doing it? There's no reason to do it. I need to make your life better. I don't care about collagen, elastin, wrinkle folds, perfect proportions. I need your life to be better, else I'm not going to do aesthetic medicine. That's why I do it. It's pro-social. If that becomes our end game, our objective, our final outcome, that's better. So we have a generation wanting to connect again. In the real world, not in a virtual world. So let's deliver treatments that improve our ability to connect again. Beauty is not about vanity, it's about vitality. And the future in aesthetics is about confidence, it's about social connection. And it's powered by neuroaesthetics. And I think it's arrived. So thank you so much for listening. If you want to learn more, come by our booth today. I'm going to be at booth 1212. I'll be signing some of my books. We're also going to be doing first impression studies there. And the first, and you can help participate. We do clinical research. You'll look at before and after photos. I'd love to get your opinion. For me, it's hard because we have to get 1,000 people to look at some of these studies. But because there's so many people here, I was hoping some of you come by the booth and do the first impression study with us. You look at photos and rate them. And I can give you more information about all of this. And hopefully you're interested. You can learn a little bit more about some of the stuff that research Sabrina and I have done. So I really appreciate the opportunity to speak to you. I hope that I was able to change the way you think a little bit. And if I gave you one tip, then I don't owe you a bottle of wine. But if I gave you 3 tips, I'll be in the bar later. Thank you so much.